I hope people can see that.
That's fine.
So let's start with the 20 years of progress that we've had. We've gone from a time when psychologists and physicians generally thought that CFS and fibromyalgia was either the result of thinking patterns, psychosomatic illness, or another form of depression, both of which are now known to be radically incorrect, to a point that 20 years later it's considered a poorly understood syndrome. But progress comes slowly sometimes, and part of this is due to the fact that fatigue is still a dark hole in professional education. Doctors coming out of medical school probably know less about fatigue than almost any other topic, and it's hard to diagnose or measure. Pain, such as fibromyalgia, tends to be overtreated with narcotics, and it's just been within the last 2 or 3 years that we've had medications that are labeled for fibromyalgia. And fibromyalgia and chronic fatigue are not the first illnesses to be so badly misunderstood. The same was true of MS and Parkinson's once upon a time. So I'll talk more about diagnosis and kind of the swamp that entails if we have some time at the end. But for the moment, let me just say that we're getting to a point where a knowledgeable healthcare professional can no longer dismiss either CFS or fibromyalgia as something that's just in your head. Of course, it is in your head because that's where your brain is, but not in a dismissive sense. So I want to talk about psychological treatment first in kind of general terms. And who are these people? I was trying to describe you to a professional audience, and I said that most of the people who I know who have CFS and fibromyalgia are overachievers, highly responsible, or type A personalities. That there's no secondary gain in having this illness. It's not an easy way out of anything. That the people who have these illnesses would much rather be well and out there experiencing what the rest of the population is able to do. And that people who have CFS and fibromyalgia have generally had their careers interrupted or held back, have lost friends who misunderstand or can't be flexible enough, have seen their pastimes reduced or disappear, and their most passionate life experiences slip between their fingers. And in some cases, it goes so far as to have family members who refuse to understand or are incapable of understanding. And almost to a person are wanting to get back into life. In fact, with CFS, this provides the interesting dynamic of starting to feel better, jumping the gun, overdoing, crashing, slowly building back up, wanting to get back into life, crashing. So if there's any question about whether the people are just using either of these illnesses as an alternative to a hammock, all they have to do is watch somebody go through this cycle a couple of times. And perhaps the most diagnostic aspect is that people with chronic fatigue syndrome in particular, and often fibromyalgia, feel worse with exercise rather than feeling better. A person who is depressed, if you can talk them into getting some exercise, generally have an improved mood and improved energy level afterwards. This is never the case with people with these two illnesses. So if we look at the impact that these illnesses have, by definition, they must have existed for 6 months or more without a known etiology or cause, without predictable outcome, and causes a major disruption in terms of our sense of self, who we are. Now, if that isn't enough to make a person depressed, what is? So, depression oftentimes occurs with these two illnesses, but is not the equivalent or the cause of these illnesses. CFS and fibromyalgia almost always are accompanied by strong feelings of grief, confusion, and anger. And one's identity or one's sense of who we are ends up like Humpty Dumpty, where all the king's horses and all the king's men can't put us back together again. And so we lay there in our homes, cut off from the world, wondering who we are and how are we going to respond to this. Well, I would join a colleague of mine in proposing a stage theory of illness. And I'm going to share this with you, even though it's very theoretical, because I think you might recognize yourself as we go through this. There are 4 phases in this model, and the first one is crisis. So all of a sudden you're out enjoying life, and you have a sudden onset of a disease for no reason at all, or disease comes on slowly but inexplainably, and you're thrown for a loss. You don't know what is happening. Phase 2 is stabilization. The person starts to kind of adjust, get their feet back underneath them slightly, and be capable of doing something constructive. Phase 3 is resolution, in which we start to benefit from the changes that we're making. And stage 4 is integration, where we have woven our disease experience into the rest of our life, and it becomes one of the many aspects that we experience and identify with. So I want to talk about these briefly in terms of how I go about treating, and psychologists who are knowledgeable might do so as well. But to kind of explain the value of this, I would say that if you understand, a professional who understands this stage theory is more likely to be able to accurately empathize with a patient rather than looking at them in a confused or questioning sense or challenging their experience. Patients respond best when interventions fit the stage that the person is in, so the doctor isn't expecting the patient to do something that is beyond them. And that when interventions do not correlate with the stage, the patient might be non-compliant or sabotage treatment. This is not because of a perversity within the patient, but because they're not capable of what's being expected of them at the time. So phase 1, the crisis phase, has characteristics that probably most of you are experiencing or can remember. So many of the people who attend meetings here went some time without being accurately diagnosed. It's somewhat rare for a person to have either of these conditions and be diagnosed the first time they see a doctor. the chance of misdiagnosis is very high, and as a result, people with CFS and fibromyalgia go doctor shopping, looking for somebody who actually can understand that. And the emotions that go with the first phase include surprise, bewilderment, denial, attachment, and anger. And we'll talk more about those. Attachment is perhaps the strongest and sometimes most poorly understood, and that's that if we have something that is good for us, we're not likely to let it go very readily, and so we hold on to the life that is slipping from our fingers. It's inevitable for most people in this phase to look for some kind of a magic bullet, some kind of panacea, something easy. And if they can't find that, to start bargaining. In other words, there's a pill for everything, so there must be a pill for this. And if there's not, well, I'll cut back on my exercise by 15 minutes, but I'm not going to give this up. I'll stay home one night a week, but I'm not going to leave my social group behind. I can't possibly resign any of the committee chairmanships that I have, because who could do the job, and so on and so forth. The result is that symptoms tend to exacerbate or flare, and a person in crisis, in phase 1, finds themselves getting sicker and sicker because there's been no insight into what is happening, and oftentimes just the beginning of medical care. And still, patients try and pass for normal. So we put on a good mask, we don't complain about our experience, we try to show up for everything on time, and pretend that this is going to go away. So the treatment in phase 1 begins with just trying to manage the trauma and the crisis, to help a person understand what is happening to them, to understand that it's not their fault, that this is not something that's going to go away just simply by wishing. It depends, the stage of treatment really depends on empathy, validation, and acceptance. Most people with CFS and fibromyalgia are carrying around the question, am I really sick? Am I maybe making this up? If I just tried harder, would I be able to push through it? And when they do talk about it with other people, I usually get blank stares, or advice, or challenges. And so it's the doctor who can listen in an accepting and understanding way that can begin to create a working alliance. Now, I'm referring to psychologists because it's typical that physicians who live in a world where insurance reimburses for a 7.5-minute appointment are not likely to be able to go into very great depth about a patient's usual experiences. We have two major exceptions here in our community. Both Dr. Bateman and Dr. Smith are, I will sometimes say, undercover psychologists. They're psychologists in disguise, in the sense that they're more interested in understanding the person than watching the clock. Cindy does a 4-hour intake, which I've never heard of anywhere else in the country. Dr. Smith will take as much as an hour sometimes with a patient who's really struggling. But this is unusual. And so it's usually the mental health provider who's in a better position to go into detail with a person's experience. And as that happens, then the therapist can help the person recognize that it's not just that they're tired and that they're in pain, but there's something real and important happening to their sense of who they are. Who am I? And there's a tremendous loss of ego that happens during this time, and for the doctor to be able to help the patient understand that. So, you know, when I think about myself in terms of descriptors, I could say I'm a psychologist, I'm a father, I'm a river runner, I'm an outdoorsman, I'm a skier, I'm a woodworker. I have all these things that describe me. And I can get into the non-doing aspects and say, well, I'm quite generous and very patient, and so on and so forth. But all of our descriptors start to change when we're tired and in pain. And it's not because we're not trying hard enough. It's because this is inherent in the disease process. So early on, the patient who is resistant to a person's interventions is behaving normally. And during phase 1, a knowledgeable provider will expect little or no improvement because at that stage it's simply creating a foundation for what can follow. If we look at the stabilization phase 2, this is where a person starts to grasp the amount of interruption to their activity, their accomplishments. They become more objective about what they can and cannot do. So instead of trying to do what they used to do, they have started to recognize that that is historical, and that the question at the moment is, what can I do? And in being able to accept more appropriate expectations for ourselves and to be able to dial that in, ironically, we start to develop some confidence, some self-control, and some ego strength in doing so. So it's in actually beginning to make the first changes that we start to get some traction. And so during this stage, for the first time, a person is capable of adapting and coping with the imposed limitations. Part of this process is to realize that coping and adapting is not simply the requirement for people who are sick, but is a requirement of the human race. You know? So before we became sick, we were adapting and coping, but we did it more unconsciously. We did it perhaps with less thought. During this phase, people then start to reach out to other people. During phase 1, oftentimes the individual has been rejected, overlooked, left behind by people. During stage 2, it's possible to realize that we're living with different parameters and to reach out to other people who share similar parameters rather than trying to run after a group that is quickly leaving us in the dust. And it's at this time that there's the first sense of chronicity. In other words, this is going to be with me for a while. And that recognition dawns slowly. We don't want to know that. We don't want to admit that. And it takes time, patience, wisdom to let that reality in. So if we look at the treatment from a professional point of view, it's in stage 2 that what we would call the work of personal growth actually begins. When I'm sitting with somebody who has either of these illnesses, my primary task is to encourage their self-observation and their insight. People are naturally insightful to some degree or another about themselves. Occasionally people seem to be completely lacking those qualities, but it's rare. But the very process of losing one's health tends to direct our attention away from ourselves because we don't want to feel the pain, we don't want to feel the loss, and so we become less insightful. We become less self-observant. And it's in stage 2 that this has the opportunity to turn around. So we have to start grappling with psychological defenses. And psychological defenses are positives in the sense that they arise when we're not ready to deal with the impact of a situation. It's like a circuit breaker on your electrical panel at home. If you overload an outlet, the circuit breaker will trip before you actually have wires melting or a fire occurring. And one of the ways that we prevent ourselves from becoming overloaded psychologically is to go into denial. And I'm not talking about the river in Egypt, but a psychological process in which we say, no, that's not happening, that's not me. And when a person in denial is confronted, it's typical that an argument or a discussion or a shutdown occurs. So it takes a certain trust for a person to let another challenge them in a way that that denial becomes obvious. Characterological interventions refers to the process of basically overhauling one's personality. One person who recovered from this illness after 4 years of being very sick was asked, "How did you do it?" And his answer was, "I simply had to change my entire personality." Type A, highly responsible, passionate, jump before you calculate sometimes, and instead to take a much more planful approach to be able to accept limitations gracefully and not with deprivation and so on and so forth. It's during this phase that a lot of people start to get in touch with emotions that perhaps have never been available to them, or emotions that have been pushed away during the early phase of this illness. Because there's a lot of grief in losing one's health. And to be able to feel that grief and to be able to let that sadness be present is not something that's easily done, and sometimes not done without some professional help. I think one of the silver linings of losing oneself is that it's a colossal clarification of values exercise. So if you didn't know what was important to you in life, this propels us to reflect and look at ourselves to find what those values are. Because if you have very little energy, if you're impinged by pain, then you can't afford to go out and do the frivolous and the mundane. What you have energy for is really only the most important things in your life. So, in addition to clarifying values, we're also sometimes pushed to change family relationships. That's an uncomfortable process. We're always afraid of people getting hurt, people abandoning us, of this unconscious idea of upsetting the apple cart. But family structures can oftentimes put too much responsibility on one person, or leave one person the cause of everything that's going on in the family. Professionally, we refer to a scapegoat as the person who is being blamed for everything. And for a person to say, no, that's not me, is enough to create a revolution in some families. Who would want to do that? Also, the loss of health sometimes requires a major examination of the marriage or the relationship that you're in. And professionally, I do a lot of work with caregivers because my conceptualization of illness is that in a marriage or a committed relationship, that both people have the illness. One person has the symptoms. The other person is the primary impact site of all of the consequences. And it's oftentimes the partner who loses their dreams as well, or has to cut back on some of their behaviors as well. And a marriage that doesn't kind of re-examine the fundamentals and even create a new contract oftentimes ends up separating or distancing. Phase 3 is the stage of resolution, and if there's one thing that characterizes phase 3, it's that the person starts to feel in control again. So instead of feeling like the world is doing this to me, that fate has it in for me, that I'm out of control, I'm not in control of this, but I'm just making the best of it. Instead, the person starts to realize that there are a whole host of choices that they can make. That it's up to us to reinvent ourselves, to, instead of chasing after the life that was lost, to try and create a new life that is a good fit with what our body is telling us and what we are telling our body. In phase 3, we start to understand the whole process of stigmatization. In other words, all of the people who think that we're so weird and have rejected us and belittled us and misunderstood us are simply acting out their own internal assumptions and beliefs. And that when somebody places the negative label on us, it's not about us. They're the person who is putting the label forth. And understanding this principle, not just intellectually, but emotionally, makes a big difference in getting out of the feeling that we're weird or we're broken. And this reduction in self-pathologizing leads to an increase in self-esteem. That, in turn, then allows us to be more tolerant of others who aren't supportive, who aren't understanding, and a toleration for the chronicity of this. And as we start to develop a respect for our suffering, there's a development of meaning that comes with it. And with that comes a source of inner creativity. So we each have our chosen passions and our unintended legacies, limitations, and such. And we tend to accept the one and reject the other. But when we can take the whole picture and say, this is me, and what am I going to do with it? It's a very creative act to create a new person from the ashes. We can decide who we want to be as it is conditioned within the reality of this world rather than in spite of this world. So treatment in phase 3 is a matter of insight, expressing feelings, and grappling with the existential dilemma, who am I, and why is this happening to me? And during this phase, a person becomes more authentic, finds more meaning in life, tends to find their faith and their sense of humor becoming stronger. And there's a reason why I put both of those on the same line. I'm not just trying to economize on space. And the creative activities that we have become more important to us. Okay, moving on to phase 4. In phase 4, illness becomes just another part of our life. And as a father who got very little sleep when my son was an infant, and now again I'm finding my sleep interrupted as he's an adolescent, and finding that I'm spending far more money on clothing for him than I ever planned. There are a lot of parts of our life that aren't entirely welcome, even though they're normal, and we have chosen them. Somehow we make illness into such a culprit, such a bad guy, that all of the unwelcome things that come with it are bad because who would want to be ill? Well, they're really not welcome, but they're not that much different than a lot of other parts of our life. And for any of you who have had a boss that's insensitive and fault-finding, you have had an example of not being accepted, irrespective of whether you have an illness or not. So the unfortunate pit that a lot of people get into is that they think that the way out of illness is to recapture what has been lost. Chasing after that actually intensifies and maintains the symptoms. So it's only when we get to a point of recognizing that we have to create a new sense of self and integrate with that our earlier sense of self, that we're positioned to move out of this illness or to a level of reduced symptomology. So it's during this time that changes in roles become firmed up and normalized, that our sense of meaning seems to be one of the primary motivators in our life, and a person can really, truly feel like they're questing for a full life, and not simply a life that's half full. Treatment during this phase looks exactly like the treatment that I provide for all of the rest of the people who see me, because it's the process of making sense of life and making life work. So we talk about the new self, we're exploring free will, broadening a sense of meaning, and developing stable, healthier relationships, optimizing family relationships, making necessary workplace changes on occasion, and pursuing self-actualization. these points are basically what Abraham Maslow talked about as the self-actualization of the person. So in phase 4, we've really kind of rejoined the rest of the human race in terms of trying to integrate the separate parts of ourself into a whole. Okay, so how are we going to do that? One of the most effective ways, I think, of going through this arduous journey is with the help of a group. And a group becomes a microcosm in which we have the chance to see ourselves in a mirror that can become a trusted source of information, and where we feel support and less isolated. Group psychotherapy can address isolation, denial, shame, and the changing expectations that are forced upon us or chosen. And it can promote insight, cohesion, emotional expression, and interpersonal learning. At a time when I was doing my doctoral training at Stanford, they were running groups for women with breast cancer. And those of us who were getting additional training in group psychotherapy were electrified to hear that the research from Stanford was that women in group psychotherapy not only had reduced symptom effects and a higher satisfaction for life, but had an extended life span. People lived longer, having had the chance to participate in this. And I think that same set of results is very applicable to chronic fatigue and fibromyalgia. And my partners and I run groups for that very reason. Pacing is far more complicated than what people think that it is. The people who did the river trip to Moab, I think, were surprised by how there were steps and aspects of pacing that went beyond what they had ever imagined. And on the occasions that they could pace themselves a little bit more realistically, felt better. However, this is something that's learned. It's not at all intuitive. It's counterintuitive. And it requires not only limiting activities, but a certain amount of scheduling, because it's never convenient to rest. And while with fatigue, intense fatigue, we might have only one thought in our head, which is to lay down. Where can I lay down? As soon as we lay down, the second thought in our head is, I wish I could get up, right? So there's nothing natural about this. This is a learned habit, and we have to contend with a whole variety of conflicting messages from within. For people who have not grown up with the Lord's Prayer, I always like to teach them the one part that says, and lead us not into temptation, because that is the greatest hurdle that we have to get over in healing with either of these illnesses. You know? The world is incredibly tempting. Oh, I could go to that concert if I just sat down, or I could go grocery shopping if I get there early, or well, I'll just go to the family reunion and stay for an hour. You know the list. So the difficult first step in pacing is getting a baseline. You know, what is it that we can sustain for weeks rather than just a few days, despite the fact that there are lots of surprises that happen in life. There are things that we didn't plan on, things go wrong, And the baseline has to have room for those. And it's very difficult to figure out what our baseline is, but it's the starting point. And it usually kind of requires a kind skeptic who will say, do you really want to do that? Do you think you're up to that? When's the last time you've rested? And the whole process of pacing is not going to succeed as long as a person has the mentality of deprivation. So if we see pacing as a way of giving up the good stuff, having less of life, of yielding to an enforced reality, then we may be able to pace ourselves for a brief time, but we're going to rebel, we're going to escape, we're going to revert as soon as possible. So it's only when pacing becomes the most valuable thing that we could do that it actually has a chance of fitting into our life. And a rheumatologist who I used to work with, who treated a lot of fibromyalgia, half of his practice, said that the most difficult thing about fibromyalgia is that you don't know the consequence of what you've done until 3 days later. Right? I'm seeing nods. So, you know, it's this delayed effect that is very confusing. Because off the top of my head, I can't tell you what I did 3 days ago. If I pause, I can start reconstructing it. I can get back there. But it's not information that's at the top of my head that I would use to explain why do I feel so much pain, you know. So the process of seeing cause and effect with either fibromyalgia or CFS is very difficult. And sometimes it requires something like charting or journaling to get a sense of. Dr. Smith and Dr. Bateman both, when they see a patient with either of these illnesses for the first time, are probably likely to first look at the factor of sleep. It is one of the most important symptoms to try and get under control. And actually, it is one of the symptoms that doctors know a fair amount about. We know what the sleep architecture is. We know that stage 4 sleep is where growth hormone is produced, and so on and so forth. There's a lot that can be done pharmacologically, and there's a lot that can be done in terms of self-management. And if we don't understand the impact that our tiredness has on us, or the importance of the lack of sleep, it adds to a sense of helplessness. Once we realize the importance of sleep and where we're not getting enough, we've already explained part of our experience. We may not like the news, we may try and cheat, but at least we have some sense of an aspect of these two illnesses. So there are some valuable sleep meds, but there aren't any great sleep meds. Anytime that something isn't addictive or prone to dependency, there's the chance of becoming accustomed to it and losing treatment efficacy. And so even something like Ambien usually requires vacations from it. And Ambien will help you get to sleep, but it won't keep you asleep. And it doesn't give you the full range of sleep. It doesn't bring you to stage 4 sleep, which is very valuable. So while meds can help, most of it is something that we need to do in changing our thoughts, our feelings, our evening activities. And for the most part, psychologists and mental health workers have more time to work these things through with a person than does a doctor. But just to very briefly run through a couple of the main points, it's important to create a comfortable environment. It's helpful to have an evening routine. It's the time of the day when you don't want to spend your time stressed and worrying. Relaxation techniques can make a big difference. And with these illnesses, there tends to be a process of bedtime creep where you're staying up later and later and later. And I know patients who find themselves going to bed at 2 o'clock in the morning and having a hard time getting up in time to see a doctor during daytime hours. And one of the more nefarious pieces of this puzzle is that if we nap every time we feel tired during the day, we're going to get enough sleep during the day that it's going to interfere with nighttime sleep. And there are ways to work with this, but there are things that we have to learn. And pacing directly benefits the amount of sleep that we have and the quality of sleep that we have. So with regards to pain, there are medications now that are better than the ones we had a few years ago. Managing pain includes looking at fatigue and looking at sleep as two of the primary culprits. Finding the types of exercise and the amounts of exercise that are beneficial as opposed to what you're accustomed to or what you believe is good. And developing pacing. In years past was a thought that pacing was really the domain of chronic fatigue, that pain, which can be elevated throughout the day, was not going to respond to pacing. We're finding out that fibromyalgia people who pace themselves have less pain. Developing the art of relaxation is one of the most important things that you can do. There are methods that are proven to work. Meditation is one of the most efficient forms of relaxation. After 20 minutes of mantra meditation, the body slows down, the metabolism slows down to a point that is equal to what's experienced after 7 hours of sleep. And the quality of rest during meditation is far above the quality of rest that occurs during napping. Progressive muscle relaxation is another form of relaxation, especially for tight muscles and for pain. And for both of these illnesses, it's important to manage your exposures to heat, cold, and barometric pressure. I think that the TV stations would be far more accurate with their weather forecasts if they just fired the weathermen and hired people with CFS and fibromyalgia, because we always know when a storm is coming in, right? And that's not anything to be joyful about, but we can start to work around it. We can find ways to accommodate that. There's a lot of problem solving, changes in self-talk, the ability to have pleasurable thoughts that very directly impact the levels of pain that we have. It's not that we cause pain by thinking it into existence, but how we think can exacerbate pain. In other words, if you've got a fire going and you throw gasoline on it, it's going to become a bigger fire. So, in treating fatigue, some of the things that we're doing are basically the same things that are done for fibromyalgia. Both of these illnesses have in common what's called brain fog or fibro fog. Is there anybody here tonight that has either of these illnesses but doesn't have this pattern of symptoms? So it is distressing and exasperating because we find ourselves being forgetful. We can be confused over the simplest of things. There's a difficulty in concentrating, and sometimes an inability to speak clearly. Not that our speech becomes garbled, but we keep failing to find words. We're grasping for words to the point that the sentences get chopped up a little bit. As a psychologist who's trained to evaluate all forms of cognitive impairment, from brain injury to alcohol abuse to manic depression and what have you, I have to say that these patterns of fibro fog or CFS fog are different than any other type of cognitive alteration. And there's an accuracy in this, in that people who become able to be self-aware of the cognitive limitations are oftentimes able to better estimate where their overall symptomology is than taking a measure of your fatigue or your pain. Because both pain and fatigue can spike with whatever you're doing recently. The fog tends to be a more stable indicator of what's going on inside your body. So there are a number of things that exacerbate it beyond the basic cause from the illness. And we can learn a variety of ways to mitigate that. A very simple one, or a very simple example, is that if you're reading or using your visual capacity, after a time that becomes fatigued. And if you lay down and rest and watch TV, you're not getting any rest. But if you're listening to music using a different channel, then the visual channel, has some time to rest. So cognitively, if we alternate our inputs, we can reduce our overall level of stress. Just to give one example. The biggest one is to bring down our level of stress. And almost all of my patients and friends who have these illnesses notice that the fog gets worse when stress gets higher, and as stress comes down, the fog reduces. And some days it almost seems to disappear, or it can disappear for periods of time. Then we think we're well, and we go out and hang ourselves. No, we just relapse. So there are some things that you can do that will directly mitigate this, and the first is to take rest breaks frequently to avoid overstimulation, to definitely train yourself out of multitasking, despite the fact that that's the American pathway to success. To control your stress, make sure that your physician is looking for side effects on the medications, to use lists and reminders to reduce the wear and tear on your thinking. It's a lot easier to look at a list than to try and recall something that you haven't given thought to recently. Declutter your life, organize it, make it more simple, and develop routines so that certain things get done naturally at a particular time rather than having to be making constant choices. And if you have something that's important or difficult, to try and do it during the best time of your day, assuming you figured out what that best time is. And to give yourself permission to postpone or cancel activities. If you are feeling an increase in pain or in fatigue, don't push through it. Give yourself the chance to step back, rest, and renew yourself. And the fog can be helped by physical activity, but we also know that physical activity can cause worse symptoms. In fact, some of us think that a more accurate term for chronic fatigue would be post-exertional malaise. So doing something physical for the sake of your brain might be just as simple as getting up, walking across the room, straightening the picture, and coming back and sitting down. Or if you're at your desk, just standing up, looking around the office, and using that as a cover for a little shift in your shoulders, and then sitting back down. We're not talking about 5-mile runs here. We're just talking about a little bit of activation for the body that gets the blood moving and neurotransmitters firing in a little different way. It's surprising how many people don't understand what low blood sugar feels like, but a lot of people who will skip lunch for whatever motivation then find themselves during the afternoon getting really fuzzy. And sometimes it really helps to plan and reframe your response. So if you have a teenager who's coming home after curfew, you're upset, you don't want to wait for the kid to walk in the front door and assume that you're going to be able to handle the situation adequately. Sit down, think about it, develop a few thoughts, words that you want to say, and have a reply ready when you're confronted with a challenging situation. I've reframed a quote that athletic coaches use, so in my book, when the going gets tough, the tough pause. You wouldn't believe what just a momentary pause can do sometimes. Sometimes just a minute. Sometimes it doesn't mean that you have to sit down or lay down. It can sometimes mean just taking a deep breath or asking yourself, is this really important? Or can I think of an alternative? Or just standing there looking at the situation, waiting for inspiration. But a pause can sometimes break the trance that we are in at times, where we're really not driving the train, but it's the belief that this task has to be done that is in charge. And a pause can somehow poke a small hole through which light can shine into that. One of the difficult things about these illnesses is it's very hard to measure ourselves. You know, when I go in and see my physician, she'll take my temperature, she'll check my blood pressure, she comes up with nice and neat numbers. But as I stand here in front of you tonight, and I start to feel some fatigue, and I ask myself, well, was today a difficult day or an easy day? How do I express that? You know, we oftentimes don't acknowledge that we've overdone it until we've dramatically overdone it. We will underestimate the effect of our activity if we're feeling some guilt or if our sense of responsibility is high. So an accurate measurement of our pain or our fatigue is very difficult. And we simply don't know how much is enough sometimes. This oftentimes originates in childhood. And if we adjust our calibration, we start to feel shame or a sense of suffering because we feel like we're not doing enough. We're being irresponsible. We're not being ourselves. So one of the things that group psychotherapy does very, very well is to give you a jury in which other people with the same illness and the same difficulty in calibrating themselves can look at you honestly and say, oh, you're saying that that was easy? Or how does that compare with how you felt last week? And so it sometimes takes a mirror to be able to see that. Another way we can do this is through charting. And charting has to be one of the least desirable activities in most people's lives, possibly with the exception of washing dishes or cleaning the kitchen. But there's nothing glamorous about it. And yet that's when we start to have to make comparisons and be more specific and look at the preceding days. And I have people who are migraine sufferers who sometimes have a reduction in symptoms fairly quickly once they start charting certain factors because they see how things that they've taken for granted seem to co-vary with their headaches. So charting can actually make our illness less bewildering. And we may not like the news that it delivers, but it gives us some choice about whether we want to make certain changes or not. And this can extend as far as pain and anxiety. So, we can start to correlate things such as pain and anxiety. I have a CFS patient who thought of himself as being anxious, but not dramatically so. Didn't consider it to be related to his CFS in any way until he started charting and found that there was almost a perfect correlation between his CFS symptoms and his level of anxiety. Now that's not to say that the CFS is caused by anxiety, but it means that the anxiety produces a significant contribution to the CFS. Stress resilience is perhaps the most important thing that we can aim for in phase 1 and phase 2. And there are 4 principles that contribute to what we would call stress resilience. These are factors that have been shown through research to correlate with improved health or recovery from illness. And the first is an internal locus of control. And that's not to say that the more control we have, the healthier we are. But like the Serenity Prayer in the 12-step program, it's a matter of knowing when we can be in control and when we can't be in control. And to take actions in the first case and to be accepting in the latter case. So the process of distinguishing and discerning as well as becoming more assertive, more accepting, directly correlates with health. A second is a sense of connectedness. There's research that shows that in hospital ICU units, that babies born prematurely will gain weight in proportion to the amount of time that they're held by nurses. Okay? This is before kids have had a chance to become neurotic or intellectualizing about life. This is just basic physiology. We need other people. We need to be touched. We need to feel connected. And if you're feeling isolated, cut off, and kind of out of your body, this is not going to help either of these illnesses at all. Think about getting a massage. Think about offering a friend a shoulder rub. Think about joining a group of crazy people going on a river trip. Come to Wednesday night meetings, but reach out to people. The third is a sense of purpose and meaning. People without either one of these illnesses can slip into lives that are flat and empty without having these two factors. And people who focus on adding purpose and meaning to their life usually will show improvement with either fibromyalgia or chronic fatigue syndrome. The fourth is hope. And hope is a little difficult when we have illnesses for which there's no known treatment. We don't know the etiology of chronic fatigue syndrome. On the other hand, the national effort on research is accelerating, and sometimes it might feel good to even send a $5 bill into the National CFIDS Association, or to write your congressman, or to listen to the presidential debates and see if either of them are taking a stand on health care. But finding small ways in which you can see the possibility of a different outcome, a better outcome, is very important. So a big part of emotional resilience is, of stress resilience, is emotional regulation. And the loss of health can cause strong and overpowering emotions. That's not a problem for people who are emotionally intelligent. And by emotionally intelligent, I mean a person who can recognize a feeling when they're having it, that can understand the significance of what that emotion is, and has an idea about how to act or follow through on that emotion. Emotional intelligence is not widespread in our population, but business schools have found that it correlates with business success to the point that it's the hot topic in business schools these days. And so as we become more aware and understanding of our emotions, we're going to have more cues on how to respond to illness. And the self-reflection or insight that we give to those emotions oftentimes gives us a different course of action that would come simply from a cognitive analysis, from our rational thinking, from conventional wisdom. I'm going to talk just briefly about two forms of meditation. And I want to say that people who have tried meditation based on what they've been told or heard are probably not meditating correctly. Meditation, to be effective, needs to be a systematic process that is taught by a person who has training and can ensure an accurate experience for you. There are two forms of meditation that are widespread in the United States, and others that are lesser known. And I'm going to briefly mention mindfulness meditation, which fosters an awareness of our experience and our thoughts and our feelings. And it kind of tames the illness by giving us a vantage point from which we can observe it rather than to be entirely consumed in it. And mindfulness meditation is akin to sitting at a railroad crossing watching a train pass in front of you, and simply being able to label your experience. Freight car, cold car, refrigerated car, cold car. Just being able to identify our internal experience without getting caught up in it, being hijacked by it, having the thoughts run away with us. Mantra meditation is a little bit different. Instead of watching the series of events that pass through us, we're taking an object or a sound, call it mantra, and repeating it in a particular way that is not a strict repetition or a cadenced repetition, but is a kind of a casual, informal use of it as a reference point. And each time that a thought or feeling takes us off and distracts us, when we realize that we're not thinking of the mantra, we come back to it. And so the mantra becomes kind of that safe place that we keep returning to. The process of the two are very different. I think ultimately they bring us to some very similar places. Mantra meditation is particularly good, I think, for letting go of the tendency to obsess on our fatigue or our pain. Because if we're sitting for 20 minutes letting go of every thought and feeling that passes in front of us, it gives us some basis when our eyes are open to let go of that focus on the pain that we're feeling or the fatigue that we're having. So letting go is really the name of the game in this regard, and illness challenges us to let go of a lot of things. Letting go of the past can seem impossible to some people, but is achievable. It sometimes it takes professional help. It sometimes takes separating ourselves from strong reminders in terms of place or people. But the life provides its greatest rewards when we're living in the present. And we're not living in the present whenever we have been dragged into the past. We also have to let go of an identity that no longer is accurate. My father, when he was 85, said that aging is not for the faint of heart. He found himself having to give up a lot of things, although he did not let go of golf. But illness requires that we let go of things, although we don't have to let go of our passions. We might have to find different ways of expressing our passions. That is a creative challenge. But we may have to let go of the manifestations of that. We also have to let go of our plans for the future, because obviously they're no longer relevant. Our illusions of predictability and our past feelings of control. One of my patients came in and said, okay, I think that this illness, learning to live with this illness, is like what I saw on TV this weekend, log rollers. They get out in the middle of the river on this series of logs, and they're constantly, moving their legs just to stay upright. And that kind of constant adaptation is required of us with illness. And we have to let go of the social fabric. We can't keep up with some of the people who live life as if it's a marathon. Although, if you've been in Europe, especially the Mediterranean countries, they look at the American pace of life and think we're all crazy. So it's not necessarily the case that what we're letting go of is ideal or healthy, but we're sure that it's what's familiar. And we have to give up the activities that we're reinforced for. And this is very, very tough. Some of us have had the reputation, oh, if you want it done well, give it to her. Or if you have this person do it, you can depend on them. Or this person has done it 4 times each of the last 4 years, they'll have an easy time of doing it. So socially, our world around us, expects things of us and reinforces those in us, and we have to say no. Acceptance is misunderstood by a lot of people as being equivalent to surrender, and it's anything but surrender. It doesn't imply approval. It doesn't mean that we value something or that we're submitting to something. It simply means that we see it as what is. So a person with CFS experiencing the summer heat in Salt Lake City probably found a sense of aversion to stepping out of a building and being hit by that heat and feeling the fatigue rising as a result of it. And a person can become very invested in almost doing mental battle with the heat. The idea is not that we make a move out of saying, oh, it's no big deal, but rather acceptance means that we realize that that is what is. And the second question is, and what do I want to do? So acceptance is a way of finding a choice for ourselves, irregardless of whether the event or whatever is welcome or unwelcome. Mindfulness meditation, mantra meditation, and prayer can help bring us to this place. And there's a branch of psychotherapy now that is developing out of the combination of mindfulness and acceptance. And Stephen Hayes has a book that was published in 2004 that is accessible to the lay reader and can outline some of the ways that a person can go about pursuing this. So these different concepts that I've been sharing with you essentially are ways in which we can find our way into the present. Pain is inevitable, and acute pain protects us by causing us to change our behavior. If you touch a hot burner, you're likely to withdraw your hand very fast and reduce the amount of injury. But chronic pain is usually dysfunctional. Chronic pain has much less to teach us. In fact, sometimes the only thing that it has to teach us is that we're not paying attention to what we need to pay attention to. So, suffering is optional. We don't get to choose all of the things that happen to us, but we do get to choose how we react to it. And if we can observe and accept or transcend our aversion, then the alternative to suffering is acceptance. Hopefully, this collection of ideas that I've been sharing with you helps you in the process of creating a new life. We have to analyze our losses. Some of the losses are natural. high school kid who goes off to college finds that there's not quite as much time to squander as he or she used to have. But other losses are so significant that they call upon us to replace them. We lose a dear friend to death through cancer. We go through a process of grieving that loss, but at some point we're drawn to reach out and find another person to create a friendship that provides some of those same things to us. We need to clarify values. I think that the people who do best with these two illnesses have basically reconstructed their value schema. It's not that they reject the old and start with something brand new, but every value is given consideration and thought, and occupies perhaps a different place in the hierarchy. If you're not quite sure what all of those values might be, reflect on the people that you admire. And what do you admire about them? Think about some of your proudest moments and what aspect of yourself was involved in that. Through prayer and insight, look within and see what parts of yourself speak most loudly to you. Identify your pleasures. Illness seems to strip us of all pleasures at some point or another. It's an illusion. It's the suddenness and the surprise that has occurred. But when you watch the Special Olympics and see 10 people on a basketball court, all of them in wheelchairs, having the time of their life, you have to think twice about some of the thoughts that are self-limiting. Creating new life requires a framework. One of the more dramatic statistics in the field of health is that when people over 65 break their hip, they're 3 times as likely to die within 2 years as the rest of the population. The reason is because at that age when you're bedbound and you have fewer resources, life becomes very thin. It becomes so thin that it's no longer livable. The retired person who starts every day by walking to the corner to get the newspaper when it could be delivered probably has decided that that's a useful element of a framework for a new life. And consider the arc of your life. Where did it begin? What is it transversed? What did you let go of inadvertently? What do you sense about the direction that you're going? What do you want to pick up that you may have left aside for a time? And look at that arc as having a trajectory that does influence the choices that you're likely to make. You're wanting to inch forward a step at a time. This is not an overnight process. And we want to accept both loss and values as a curriculum for learning. And that this illness has much to teach us. One person has said that chronic fatigue syndrome is the worst experience in their life, the best teacher that they've had. That comes down to the process of recognizing the vantage point for looking at loss and values. A person who lives closely in line with their values is likely to have little regret. And as a psychologist who's worked with cancer a lot and accompanied people through the last weeks of their life, I can tell you that the people who have suffered the least are the people who have lived the most authentic lives. Loss can illuminate the subtleties in our life and sometimes lead us to an understanding of our very deepest self. But in order to do that, we have to embrace the loss and not keep ourselves too busy to think about it. And illness requires us to titrate choices stemming from the utilization of loss and values. In other words, as we start to develop insight and acquire new understanding, we're not going to be able to implement it overnight. You know, it may be that the art course that you want to take doesn't start until the beginning of the next semester in January. But don't give up. Find a way to get started without waiting for the course. And realize that becoming an artist takes a long time. Family and friends become a huge challenge, and I think that the people who see me for therapy oftentimes discover that this is one of the most difficult things to wrestle with, because our families are so important, and sometimes they're the least understanding. But if you can accept that they're coming from a place of lack of understanding or ignorance, then we can respond to our disappointments and frustrations by educating them, and educating them, and educating them, and educating them. Because it's going to take a long time for them to grasp something as bizarre as this. So the process of forming an identity is a slow process, but a very rewarding one. And I think sometimes of buying a new pair of shoes that at first are quite uncomfortable, but once I've broken them in, then I'm reluctant to have them wear out. And as we try on a new identity, it's going to seem artificial at first, it's going to seem unnatural, but we live into some of our new experiences. So, help. If you're looking for help in this immense task that I'm describing, the Offer website is a repository of a treasure box of information. Research First is a website that is put up by the National CFIDS organization in Charlotte, and is the most current reflection of the fast-moving changes in research today. The CDC, Center for Disease Control in Georgia, has information. It's not always the most current, but it's sometimes very useful. CFID Self-Help is Bruce Campbell's website, and for those of you who have been at Wednesday night meetings before, you have heard us discuss that. FM Aware is a fibro site that can be very helpful. Mind Body Wisdom is the website that my partners and I have launched for our new nonprofit organization. So hopefully some of that may help. Well, the hour's getting later, people are tiring, and the pain is getting more intense. So I thank you for your attention. I hope some of this has been helpful. I think that we're going to post this on our website, on the Offer Utah website, so if you've missed some of the points, you can go back and review it, and welcome you to future Wednesday night meetings.